Hello, I'm Dr. Chang, a pediatric nephrologist from the Philippines. I have here with me the C5PL. This is what I acquired because I needed the linear probe and also the curvilinear probe and also the cardiac preset, the phased array that it has also. I've had it for 8 months and I use it with my iPad Air 4. I like it because of its portability. It's very light, although it definitely is not as light um, as the one that is attached to a bigger machine, but it is lighter than the other ultra portable ultrasound machines. And it takes very clear pictures. I'm very happy with the images that it gave me, especially since I need to see um, to assess the volume status of patients. Not only do I need to see the kidneys, but I also need the pulse wave Doppler for the venous congestion to assess venous congestion. And I also need to assess even the hepatic vein, the portal vein, and the IVC. And because it is clear, it gives you clear images. You don't have a difficulty in identifying the structures. So I will show you the images that it gave me. So here, this is the interface. This is the interface of the app, where here you see it's in pulse wave mode, but you can change it to B mode or color Doppler and the other modes with just a tap in this app. And then you can also change the name of the patient or the age based on the birth date of the patient. And we can also adjust the gain, and even here, you can also adjust the depth and the frequency as such. So for this patient, I'm very happy that it showed the outline of the kidney and even the masses in the liver of this patient. In fact, it is better when it's being used in the dynamic mode. Sometimes when you freeze the picture, then you couldn't identify the corticomedullary differentiation anymore. So sometimes it is hard to measure the cortical thickness of the patient. Even when you adjust the depth, it's still hard to identify the cortical thickness, to measure the cortical thickness. But when you see the dynamic view, you can still see the collecting system, the dilated pericarditis, as this patient had hydronephrosis. But as you see here, sometimes it is hard to differentiate the medulla from the cortex, especially when you freeze it. So it's sometimes hard for me to measure the cortical thickness, but for the length of the length and the width of the kidney, it's pretty easy to identify. For this one, when I first used the cardiac presets, so the phased array, yes, I did not have a hard time to identify the structures, the valves, the walls of the ventricles, the outflow tract, the right ventricle over here. It's actually pretty easy to identify. And when you use it, when you use the probe, sometimes when you use the cardiac preset, and then you have to center it here, being that you somehow change it to the phased array. And then you hear an audible sound. You hear a very high-pitched sound when you do use the cardiac preset. But other than that, it's not bothersome for me. And then because I really like the clear images that it shows you. So when it was new, I did not have a hard time adjusting how I held it to give me a better view of the heart. Also here is when I used it already for 5 months, I think. And then, so I got a better image of the valves and the ventricles, the outflow tract, and the right ventricle over here. So I'm very happy even with the cardiac preset because I really need it also for assessment of volume status. So I need the basic, at least basic echocardiography for my patients. And this one also to assess the volume status of the patient, I need to check the lungs. So I use then the linear probe, this other one, the linear probe to check for the lungs. As you see here, you can clearly see the spine, the pleura and the A lines. And as the lung goes into that part, it's very clear. I'm very happy with that. Even when we check for the IVC and the aorta, this is the liver, you can see the very clear image that it gives you. Because in children, we really have to measure the IVC in relation to the aorta and not just the measurement of the IVC alone. So it has very good penetration, but still with good clarity, even if it's just 3.5 millihertz. For this one, you can see here in the longitudinal aspect, you can see that it still shows you a very good image of how the IVC is connected to the right atrium there, and how it is compressed during inspiration. And this one with good compression. This one I used the higher frequency because this one was a thinner child, and you see better images, better pictures, and you see even the borders of the IVC as compared with this one. This one is just 3.5 millihertz, and this one is with 5 millihertz. Now, what I also like here is that I can use the pulse wave to measure, for example, if there is venous congestion, so I can use the waves to assess if the patient actually has congestion. And if it is improving as I follow the patient up. Now, here I can also check for the RI of the patient. I can check for the RI as sometimes it correlates to how the patient renal status is, especially for those with glomerulonephritis. Yeah, that I really need that. So I use it even for the renal artery and even in the interlobar arteries. So I really appreciate it. Sometimes you just really need to adjust the depth so you can see clearer. And then for the linear probe, I especially like it because I can assess now the patients before I refer them to the cardiovascular or the vascular surgeon for AVF creation. I put it here. So I can check the diameter of the vein and the artery and how close they are to each other, and probably do the tourniquet test if I have to. So that before, for example, these adolescents or these children are sent to the vascular surgeon, they are at least ready to have the AV fistula. Okay, so here, then I can assess for the Doppler of the arteries with the pulse wave Doppler and also the veins. So all in all, I'm very happy with this. I'm very happy with the C5PL. It doesn't heat up. I can use it for a long time, even more than 30 minutes before I feel that it's starting to warm up. But then it's not bothersome. And then I can see, because there is the charger, and it's a wireless charging. It's wireless charging. I can just leave it there in the clinic. I can just put it there, and while I'm not using it, I'll just put it on top of the charger. So that's very convenient for me. So, because sometimes I see a lot of patients a day. And then when I need to go to the ICU, I just put it in my pocket and then bring the iPad. And then I just go see my patient, and there's no problem about transporting anything that is too big. There.